my name's Tricia, I'm a midwife and welcome to the Cotswold Birth Centre in Chipping Norton. We're sitting here in one of our lovely delivery rooms, as you can see, beautiful backdrop next to the pool. And today our session is going to be about having a baby in a midwife-led unit and the care that you would receive immediately after your baby is born and in the next couple of weeks. And today I've got with me two lovely support workers. Julie?
Hello everybody out there, I'm Julie. I'm a maternity support worker here at the Cotswold Birth Centre, which is a lovely job. I think it'd be more after the birth when I get to meet you, and that's when the maternity support workers support the midwives to look after you from the initiation of the golden hour, which is a very precious 60 minutes of time for you and your baby and for daddy, and then over the next few days we'll be supporting you with breastfeeding, day 5 appointments, day 10 appointments, and anything you need in between any of those. So get your questions coming in, and we can tell you all about what we do. Now this is talk to Sharon.
I'm Sharon, I'm one of the maternity support workers also here. As Julie said, it's an awesome job and we get very excited about new mums coming in. So we're very, very keen to see you, and I hope you enjoy our video.
Okay, so as a freestanding midwife-led unit, we're here based in Chipping Norton. We're not attached to a hospital setting. So you need to talk to your midwife about your suitability to come into a unit like this. But we take any woman who's having a very normal pregnancy, her first up to her 4th baby, and we're expecting one single baby, and there's no significant underlying problems in the pregnancy. But we're always open to people who aren't quite sure if they fit our criteria. You can give us a call, you can have a chat with your midwife, and we attempt to accommodate as many women as possible here. So we're quite a quiet unit. It's a much quieter setting than at the job in Oxford. And a lot of people really appreciate that very calm environment. You're going to feel very safe and very nurtured. And in a few moments, perhaps we can turn the camera around so that you can see the rest of the room. It's quite a big room. Many of the women who come in to have their babies with us use the pool. And we also have birthing balls. I'm sitting on one. And we've got other equipment such as mats that you can use to kneel on the floor. And we encourage women very much to be upright and mobile in their labours, so you can use plenty of space here.
We're very lucky to have 2 beautiful birth pools, aren't we?
Yes, and we've got another room next door, again with another large pool in it. Both of the rooms have ensuite facilities, and we've also got some postnatal rooms which we'll perhaps show you a little bit later. So if we start from when perhaps mums arrive with us in labour, so you may well have had a few phone calls with us to discuss how the labour is going, and we encourage you to come in once the contractions are coming quite frequently, every 3 to 4 minutes. They're lasting about a minute and they're feeling quite powerful. Again, everybody is different, and we're always happy to discuss with women when it's the right time to come in for them. But it's all about you as an individual, when the right time is for you. It's not about somebody else. Or if you have any concerns earlier in your labour that you're worried about whether your waters have gone or not, please always just call us and we're happy to discuss it. So once we've made that plan and you've arranged to meet your midwife at the unit, of course that could be in the middle of the night when we run an on-call system, or it could be during the day when we're running our normal daytime activities. Then you will meet the midwife who's going to be looking after you, at least for the first part of your labour, and we'll start by doing all the usual checks that you would have at your antenatal appointment, just to make sure that this is the right setting for you and your baby for the labour. So checking your blood pressure, your urine, having a listen into baby, and sometimes we will mention a vaginal examination. It may be something you're keen to have to see where you are in the labour. It's something that is very negotiable. Some women prefer to wait a little bit longer, and that's nearly always possible. Often if women are having their 2nd or 3rd baby, we don't do any examinations at all because it's quite clear that the labour is progressing well.
Quite excited, Tricia. We have a question coming in.
Already, fantastic.
So it says, "Hi ladies, not sure if this question is allowed, but I'm due tomorrow. I will be 40 weeks. Over the past few days I've experienced what I think is a show.
Okay.
And last night and today I've been getting on and off cramps. Is there anything I need to do as a first-time mum and don't really have a clue what I'm doing?
Okay, right. So a show of some mucus loss vaginally is very common in later pregnancy. You can see that sort of show up to a couple of weeks before the labour actually starts. It's generally a good indication that the cervix has started to change in preparation for the labour happening. Sometimes we don't really particularly notice the show at all, so you might not even be aware of it. So as long as it's not heavy with blood, if it's discreet with blood, if you're having some cramping, again, often that's in the lower abdominal area, most women will feel that because that's all the changes are happening in early labour. So the cervix is starting to perhaps shorten and open, and those cramps can be a little bit uncomfortable. So remaining at home in early labour is what we would normally recommend. Potter around at home, try to relax, you can have a bath or a shower, alternate between resting and a little bit of mobilising, moving around. We wouldn't recommend that you necessarily get very active in early labour. Wait until the contractions are coming quite regularly, until we're sure that we've really got going. Make sure you get plenty of rest, some massage, relaxing music, and things that will distract you. So your partner, watching a film, some sort of activity. Some people like knitting.
And Amy, where are you planning on having your baby? She hasn't said, but
Oh,
just
yeah.
to know if she's coming to join us at Chipping.
Okay, yeah, let us know. Okay. So then once you've arrived here, we've established that yes, this is the right place, you're clearly in labour, then we would invite you to establish yourself in one of the two birthing rooms here, and there's usually a choice if they're both free, and we just get you settled in. So your partner would then join you, if they'll be waiting outside, if you can bring in anything that you've brought with you to help with your own comfort. You might have chosen to bring your own pillow. We have a wide range of essential oils that we can use in our diffuser. We've got music, we've got CDs and radio here, or you can bring your own device to plug in. We want this room to be your room. We want to make it as relaxed and comfortable and safe an environment as possible. So you can change the light levels. We've got it reasonably light today so you can see us, but we can make it quite a lot dimmer so that you feel really relaxed. It's your room.
We get
to
quite
move around.
amazed at how much people do bring in, and actually they don't need
Yeah, you don't need
massive
to, yeah, you don't
suitcases,
need
do
to
they?
bring a lot. Yeah. Think about what you're going to be comfortable wearing when you're in labour, especially if you're planning to get into the pool. As workers here, we don't mind what you wear in the pool. You can wear nothing, you can wear a bikini top, you can wear a big loose t-shirt or birthing gown, it doesn't matter, as long as we can get to what we need to get to, and it's what you feel comfortable in. Bear in mind that when you get out of the pool, you might want to bring a plastic bag to put any wet or mucky clothing in. Or if you get out of the pool for some reason and then get back in again, do you want to bring something else to put on for when you go back in? Or do you want to put the same wet thing back on? So let's have a think about that. Bring plenty of snacks for yourself and your partner. You may want to eat some high energy foods, especially in early labour. Later on you might find that high energy drinks, sports drinks, can be really helpful. Staying well hydrated is really important in labour, and we'd encourage you to go to the loo, to empty your bladder, and to drink plenty of fluid. This can help to keep your pulse nice and regular and not getting too high, which can happen if you become dehydrated. Then,
Question.
Great, go for it.
Hi ladies, I've been given a ball from a friend, just like the one you sat on, Trish.
Lovely.
Is this useful in the weeks leading up to birth?
Absolutely.
And how would you advise I use it, please?
Okay, so we would recommend that you get a really good quality ball. There's some good ones out there, they can be very cheap, so you don't want it bursting when you're sitting on it. So the ones we have a double layer. They're designated as birthing balls, which makes them a bit more expensive. But the important thing is that it is the right height for you. So however tall you are and how heavy you are, pump it up, sit on it, and make sure that your feet are nice and comfortable and flat on the ground so you feel nice and stable, but that you can move around comfortably, as I'm
Maybe
doing now.
get your pumps for you for
Yeah.
the first occasion.
Yeah. You don't want you being just on your tippy toes and feeling a bit wobbly. Also important is that your knees are lower than your hips. We don't want you to be all scrunched up. We want there to be plenty of room for your bum. But yeah, this can be a really comfortable thing to sit on in the weeks running up to your labour. Really encourages babies to get into the right position, encouraging babies back to come forwards rather than slide into the back. So we would discourage you from being in a a reclining position, no lounging on the sofa. This can encourage the baby's back to go more towards your back. And this can cause a bit of a longer labour and some back pain. So forward sitting, knees lower than hips. And yeah, get bouncing, ladies. Really good.
We've got another message from a lovely lady that I recognise the name of.
Okay.
Should you bring colostrum with you? And if so, how many should you bring?
Wow. Well, that depends on how many you've got. So some people will have explored harvesting and collecting colostrum in the weeks before their birth. It's entirely up to you. Some people love doing this, and it gives them that feeling of confidence that they've got that colostrum there with them that they can bring. We can store it in our fridge here. We don't have a freezer facility though. I would
Maybe
bring...
put a label with your name.
Yeah, absolutely. Yeah, make sure it's labelled when you come in. If you haven't done any colostrum harvesting, or if you've tried and you found it very difficult, don't be disheartened. Your body knows what it's doing. It has made that colostrum. Some people find it easier than others to harvest colostrum. It's like anything else in life. Some people find it easy, others more difficult. It's not going to have an impact on your feeding.
And bringing is something that one of us lovely MSWs can go through in terms of support workers can talk through with you over the phone and direct to some websites.
Absolutely,
Show
yeah.
some
Good
lovely
idea.
visual images.
Thank you. So as to how much to bring in, I would say maybe just bring, if you've got a lot, 2 or 3 mils. You don't need to bring all of it. You may want to just keep some of it at home for when you get back
And we've got one more question.
again.
I'm 39 weeks pregnant, no signs for labour. How can I speed it on a bit? She's very tired, bless her.
Okay. Okay. So at 39 weeks, does the lady say it's her first baby?
She doesn't know.
Okay. But whether it is or it isn't, remember for first-time mums, the average length of pregnancy is actually 40 weeks and 5 days. Everybody is an individual, and some people will always have their babies at 42 weeks, and other people always seem to have their babies at 38 weeks. But most of us only have 1 or 2, so we don't really get to see that pattern evolving. The things that you can do are increase your oxytocin, reduce your adrenaline. Think of it as like a seesaw. Think of the things that make you stressed. These are the things which are releasing adrenaline in your body and making you very tense and ready for that fight or flight reflex. So arguments with your partner, getting uptight about things at home, worrying can really increase your adrenaline and can be a bit of a block in labour. So look for the things which help you relax, and that could be a nice cuddling massage, snuggling up with your partner,
Nice dance.
yeah, dancing, listening to music, watching romantic films, massage. We know that massage and touch, whether it's from another person or whether it's having a bath, these things release oxytocin and help you to feel more relaxed. So try and chill at home, find things to keep your mind occupied but without having to think too much. So again, things like crafts, knitting, baking, tidying cupboards.
How many times have you had a cake brought in?
Yeah, absolutely. Yeah, get yourself involved in the recipe, tidying out a cupboard or a sock drawer. All these things are things that you don't need to pay too much attention to, and allow yourself to relax. Get your partner on board, massaging your back and your feet, having that bath, chilling out, focusing on seeing your baby, and just visualising the baby arriving and being with you.
Question for you, Julie.
Okay.
Can I hire a TENS machine through the MLU, and how much? Currently planning to give birth at Spire's unit.
Okay, at the moment, unfortunately, no, with the OUH are not letting us hire TENS machines. You do need to go and buy your own. But when this is all over with, yes, we've got them for hire here, and everybody will be able to tell you how much they are.
And there's
Sorry
two
about
different types, isn't there, as well? There's a sports type and a maternity type. So it's important you get the one specifically for maternity.
Yeah, which has 4 pads with it rather than the 2. You might find if you ask around amongst friends or have a look on Facebook or Gumtree that there are people who are selling them, and you can buy clean new pads which you would anyway, so that it is new for you. But yeah, definitely a lot of people find TENS machines really helpful. And if you are going to use one, we'd recommend that you use it from the very beginning of the labour, and you can use it all the way through unless you're in the water.
And practice with it before you go into labour.
So you know how it works.
Yeah.
Lovely. We're quiet for questions at the moment.
Okay, then I'll chat a bit more. So we're really encouraging women once they're here in an active labour to be mobile and moving around. So you might spend some time on your ball and find that that's quite comfortable. you might want to get up and move around. Julie, would you mind standing up? Because I'm a bit short and Julie's taller than me, I'm going to pretend that Julie's my partner. So having your arms above your head, as you can see, really helps to open out the pelvis. So putting your arms around your partner's neck, you can have a lovely rhythmic swaying dance, and your partner can take some of your weight as well. That can be a really lovely way to labour for a little bit. And we always say no one position is the best position, changing positions is what really helps. Then even before you get in the pool, you might want to use it to do a bit of the squatting, helping you to relax, moving around, swaying your hips. Women will often just do these things very naturally without us even suggesting them.
And it's lovely that your partners can sit here and support you while you're in the pool, and they can also choose to get in the pool with you if they want to do
absolutely,
that.
And they can be rubbing your back before you get in. If we could just turn the camera a little bit this way, so I'm just moving it around. So the bed in the room, okay, the beds get really quite high, so I can move it right up to this height. So you could be standing up and leaning on the bed, or you could be sitting on the ball and leaning on it much lower down. And it can be a nice place to just lean on, or you could be leaning on the bed. Very flexible. Okay. And then, of course, we've got the wonderful pool.
Is that Trish? Someone's asked what the benefits of a water birth.
Well, we know that immersion in water and the warmth and the touch of the water helps to release oxytocin. So it's a definite benefit in encouraging the labour forward. In addition, it takes your weight and it enables you to maintain positions, squatting or kneeling, that perhaps would be harder to stay in for longer if you're on the land.
You know, as ourselves as women, don't we? If we've got a really bad period, actually relaxing therapeutic properties and a nice warm bath.
Lots of people find it very relaxing just having a bath in terms of releasing stress. So again, pool is here for you. We have it quite deep so that your bump is covered, but we want you to not be bobbing around. So the depth of the pool will be adjusted once you're in.
Lovely little mirror, don't we? To see what's happening.
Yeah, we have a mirror that we can use so that we can see if babies are beginning to emerge. We can
just about see that it's lit up, I think. Video, so we'll just see it's lit.
And the pool temperature, while you're labouring in the water, you can have it at whichever temperature is most comfortable for you. At the moment it's very hot, so you might find that you want to have a cooler temperature. If baby is going to be born in the water, it needs to be up to body temperature, so we will drain off and top up so that it's nice and warm.
Well done, you just answered the next question.
Fantastic. We understand that when babies are born, it's the change in temperature that makes them take that first big breath of air and inflate their lungs for the first time. And so obviously we don't want them to do that under the water, so the water needs to be as warm as your inside, so at around 37 degrees, so that when babies are born, they don't even realise they've been born. In fact, many babies born in water don't cry at all when they're born. They can be very, very quiet and calm, and you're just going to lift your baby up and have a lovely cuddle together.
They're quite shocked for parents because they're waiting
for that
initial cry, aren't they? If they don't get that, they think there's something wrong.
Don't worry, your midwives will be on hand to make sure that everything is fine.
Lovely.
Okay. Any questions?
No, we're doing well.
Okay. So, so I'd say the majority of the women who come and use our unit here do use the water. Some people will get it and then say, I don't like it. And then you can just simply get out. That's fine. It's what works for you. They may be walking around. Especially at night, there's no one else here at the unit. You might just be using the corridor. You can walk up and down. You may want to kneel on the bed. There's lots of positions to give birth in. But I'd say the majority of women give birth either in a sort of semi-sitting position with their knees up, often in the water, or in a kneeling position, and that can be on a mat on the floor, on the bed, or in the water, so that's a common position. It gives lots of space for the pelvis, and women very often instinctively just get into that position. Okay. So I think if we move on to what happens after, so baby's here, whether the baby's been born on land, so to speak, or in the water. As Julie mentioned earlier, we're really trying to promote what we call the golden hour. So this is about that first hour or so after the baby is born. We're going to try and keep interventions and fuss to an absolute minimum. Baby's been born. It's an absolutely enormous moment in your lives and in baby's life. We want baby to make that transition as calmly and comfortably as possible. And so, wherever we can, We encourage baby to have some direct skin to skin, so baby will be passed directly to you. You'll be holding your baby at the chest height. And the benefit of that is that baby can then hear and feel your heartbeat, something that they're used to, have been listening to for months and months. The warmth from your body, whether you're in the pool or not, because you've been labouring, you'll be warm, helps to keep baby nice and cosy too. And your smell and your voice, all of these are very familiar to the baby. They'll be able to hear dad's voice as well. This helps babies to calm down, recover, and then start to explore the world that they've arrived into. So most babies, when they're born, are very alert and awake. They may often look around, taking it all in. They want to look at your face. Babies can see around 10 to 15 centimetres when they're born, so if you're holding a baby close to your chest, they can see your face and they will look at you very intently. With time, babies will start to stretch themselves out, move their hands and feet. They'll relax, and then they will, with time, probably begin to explore and look for the breast. At some point, we would like to help you with the birth of the placenta, which needs to come after the baby, and that's something that you probably discuss with your midwife, whether you would like to wait for your body to naturally act and release the placenta from the uterus so that it's born on its own, or whether you would like us to just speed up the progress of the removal a bit by giving you an injection. But it's something that we can discuss when you're here in labour, and we can do whatever seems right at the time. So with the placenta out of the way and the cord clamped and cut, and again, ideally we will wait for the cord to carry on pulsing for some minutes after baby's been born, so that they get the benefit of all that extra blood from their own placental circulation. And then dad or mum or the midwife, if you prefer, will cut the cord, and then that's it, baby is free. When the placenta has been born, we always check it to make sure it looks complete, that there's nothing big left behind in the uterus, which can cause problems with sometimes with bleeding or with keeping the uterus well contracted. And some people want to watch while we're doing that, other people don't. Some people want to take the placenta away with them. If you don't want to take your placenta home, then we will dispose of it safely.
Going back to your golden hour, Trish.
Oh, yeah.
A lot of people bring phones in with them as well, don't they? So that's a lovely point to get precious photographs of, you know, the three of you. Or four if it's twins. But yeah, three of not here. Okay. But yeah, if it's the three of you, and take that time not to go rushing off and ringing friends.
Oh,
you know,
yes.
really have that moment for yourself.
Yeah.
We've got a few questions coming quick and fast here.
Okay.
If I'm on a growth pathway, can I still birth at Spires?
Okay, that will very much depend on the opinion of the consultant team. So when you have your next consultant appointment or your next scan, do discuss with them, because sometimes at that 20-week scan you might have been put onto pathway D because there were some concerns about the placental function or the baby's growth, but then later in the pregnancy it might become clear that the baby's growth is actually fine and you would be able to go to a midwife labour unit. So all the time, make sure that you're discussing it with your caregivers and make sure it is recorded really clearly in your blue notes. If we see women here and when we look at their notes, it becomes a little bit unclear as to whether they're still under consultant care or not, unfortunately we would usually have to say this is not the right setting. It can be very hard at 2 o'clock in the morning to get hold of somebody to say definitively, yes, they can stay there. So we don't want to disappoint people. So if there's any concerns about your pregnancy, please make sure that your midwife and your consultant, if you're seeing one, have got a clear plan in place.
Okay, we've got a couple about the pools. So, can the birth partners get in the pool with you?
Yeah. So our pools are reasonably big. They're not massive. We're very happy for dads to get in. Bring your trunks, dads, okay? It's up to you. You can get in, you can not get in. I'd say dads often say they're getting in, and actually they often don't. But ideally, yeah.
But I think they often think the birth is going to be messy, but actually it isn't always.
It isn't always. Yeah, something can be a little bit messy sometimes, but yeah.
I'm planning a water birth, says one of our mums. I'm worried about baby coming out and dropping to the bottom of the pool and picking her up. Can the midwife catch her?
Okay. So when babies are born under the water, we try to not stimulate them. We don't want to try be triggering any of the baby's immediate reflexes. So if everything is going well, usually is, then baby is born, and then the midwife will just help to manoeuvre baby through, usually between mum's legs, and can help mum to pick the baby up. The pool is not that deep, and you'll find that if you're kneeling in the water, the baby's actually quite buoyant. They don't sink like a stone, and picking them up is not an issue. Babies are sometimes under the water for 5 or 10 seconds. It seems like a long time, but it's really not a long time.
Well, this is lovely. Thanks, Florence. Thanks for doing this. Really appreciate it.
Oh, good.
If both birthing pools are taken, do you have baths in the other room? And also, how many rooms do you have? Are we ever likely not to be able to get in when required?
Okay, as I said, we're a very small unit here in Chipping Norton. We have 2 birthing rooms. We have about 110 births a year, so you work it out. I think we've had really mad days here where we've had, I think, 4 births in one day, is the most. We've never had to turn somebody away because of lack of space. I think very occasionally we have mums come in who've had babies before, where the baby's born before we've managed to fill the pool, but we've never had to turn someone away who wanted to use the pool, so it shouldn't be a problem here. The Spires unit, they have 3 rooms, each of which has a pool. They are a much busier unit, but I think that it's, again, quite rare for women who want to use the pool to not be able to use one. So if that's your plan, it should be a possibility.
So we have one related to transfer, and they say, I think once this lady is really useful. I'm pregnant with my first child and currently thinking of having a baby at the Cotswolds. Fantastic. Just wondering what the transfer rates are for first-time mums, and how long does it take to get to the JR? Sorry if this has been asked already. You haven't asked.
No, we haven't. Okay, it's a question that always gets asked.
Yeah.
Okay. So the first thing to remember is that the vast majority of mums don't get transferred. They have their babies here, they remain here afterwards, and then simply go home afterwards with their baby, happy and well. So you are more likely to be transferred if it's your first baby, and statistically you're most likely to be moved to the John Radcliffe, which is where we would always go to, because the labour has become quite long and you're getting tired. I'd say in the last 6 months or so, probably around 15 to 20% of first-time mums are moved during the labour. And this is actually, it seems like quite a lot, but it's actually very consistent with midwife-led units across the country, and in fact better than in many other areas. The midwives are here to look after you and your baby, and they are constantly alert for signs that the labour is not progressing well, or that there are indications that it is no longer the right setting. So this could be something like mum's temperature goes up and we're worried about a potential infection, or their blood pressure increases. We're never going to move somebody immediately. We're looking at all of the factors and seeing if it's something that we're doing. So for instance, if the room is really hot, let's see if we can cool it down a bit and see if mum cools too. If you are transferred, we don't have ambulances sitting outside waiting. We have to call them to come to us. And the length of time it takes them to get here does depend on how far away they are. But on average, it takes about 20 minutes for an ambulance to get here, because we will be asking for an immediate response emergency ambulance. And then usually, because we've got the blue lights and sirens, of course, we can get to the John Radcliffe on average in about 30 minutes. The midwife will always accompany you with your baby, whether the baby's been born or after the baby's been born. So you'll not be travelling on your own.
It's a very smooth transfer.
It
We're
is.
explaining to you why we're doing it and what's going to happen when you get there en route.
Yeah. Statistically, it is just as safe for your baby to be born here in the midwife-led unit as it is in the obstetric unit at the John Radcliffe. And it's important to remember that. We wouldn't be able to run this service if it were not just as safe. We're all fully trained, all of us, in all of the emergency procedures that we need to deal with things that can happen in labour and birth. And we will be doing those same things that would happen at the JR. Some women are transferred after the baby has been born because they've perhaps lost more blood than we would expect, and they are then feeling very tired, or their blood pressure has gone down, and we need to make sure that they're in the right setting so that they can have just a doctor review. Very, very occasionally, babies need a little bit of extra support after they're born, in which case, again, we will do all the normal support things that babies might need, but we would always move the baby to the hospital setting so that the paediatricians can review a baby that's needing support. again, these things are usually not predictable, but we can usually see them evolving. So your midwives are always checking things, listening to the baby's heart very regularly to make sure that they are fine, that the baby's not becoming distressed, and that mum is also well. I hope that covers all of the questions.
Do you want to talk about meconium? If babies
Oh,
born
okay. So meconium is something, it's the first baby poo, it's that black, tarry, sticky substance. Babies are forming it in their guts through the last few months of the pregnancy. It's made up of skin and hair that the baby has shed throughout its time in the uterus. And it builds up as this very black, sticky stuff. It helps to keep the baby's gut open while they're not using their gut because they're not having milk. They're getting all their food through your bloodstream and in their bloodstream. Babies will usually pass meconium after they've been born. And occasionally babies will pass meconium before they're born. So if your waters are broken and we notice that the colour of the fluid that we're seeing is staying lightly green, this would normally suggest that the baby's passed the poo sometime in the last couple of weeks. And it's not usually a concern at all, and you would remain here. If we're seeing really significant black meconium, this can be an indication the baby has become a little bit stressed, and this would usually be a reason for us to move you to the John Radcliffe. So this might happen and be noticed before the baby's been born, in which case we would move you before the baby arrives. If the baby's birth is clearly very imminent, we're not going to move you. Baby will be born here, and then we can do some additional checks. Again, if it is very thick meconium, there is a risk that the baby inhales the meconium during the birth process, and it can sometimes cause a lung infection, in which case extra checks would be done at the John Radcliffe to make sure that your baby is well.
Okay. And that answered that for you.
Okay.
Another question. I never sleep on my left at night. Can I move to turn onto my right hand side when my hip goes numb?
Yes,
Just trying
of
to
course.
get comfortable and finding it a little
Yeah.
difficult too.
Yeah, okay, obviously, yeah, it gets very uncomfortable in late pregnancy, especially when it's hot, as it is currently. So yes, we know that the blood supply to the uterus and the placenta is slightly better if you lie on your left side, in the same way as we put people onto their left side in a recovery position. But clearly you can't lie on your left side all the time because you will get quite stiff. And baby will like it if you move around. So by all means, roll over through going on your back onto your right side. Most women will find in late pregnancy that they can't lie comfortably on their back because the weight of the uterus compresses those big blood vessels that run alongside your spine, and that can cause a reduction in the blood flow to the lower part of your body and to the uterus. But you would feel unwell, and you would automatically turn to either your left or right side, even if you were asleep. When you're asleep, you're still very conscious of what's happening with your body. So yeah, lying and then rolling is absolutely fine, quite normal.
So another lady hoping to have a baby here at Cotswold all the autumn.
Lovely.
I'm currently only 24 weeks, but we do need to book. Do we need to book in?
Do you know when you're having your baby?
At what point in labour do we need to leave home and come in? She's 24 weeks currently.
So you can't book the day because you don't know when your baby's going to arrive. Okay. So talk to the midwife who's your regular community midwife about coming here. If you're in our group, then we'll be seeing you anyway. If you're coming from out of area or a different part of the Oxfordshire Trust, then we'd usually suggest that you have at least one of your later antenatal appointments here, perhaps your 36-week check, so that we can just run through birth here with you individually. Keep in touch with us. If you've decided that you're going to come here, or if you're going to the Spires, or to the Horton MLU, or indeed any other MLU, talk to them through the labour, and they will, with you, find out when is the right time for you to come in. It varies a lot. Some people never seem to get above 2 contractions every 10 minutes, but if we're seeing good, steady progress in the labour, then you come in there. Other people are having 3 or 4 contractions every 10 minutes, and will come in, perhaps earlier. It's all about what's right for you. So keep in touch with your midwife. Bear in mind how long it's going to take you to get to the unit you're going to. And remember that units like Chipping Norton, where we have an on-call system, we aren't here at night unless we've been called in for a labourer. So we need to get out of our beds and come and meet you here as well. So you need to sometimes allow time.
And it's awesome for parking. You never have any problems
Yeah,
with parking.
free parking.
Which is good.
Plenty of space.
So, a lovely student midwife is watching, and she's got such a lovely birthing room and lots of great info, so that's really good. You can't really see the rest of the birthing room, so should we show it around? And Trish, there's not actually very much in this birthing room that we actually need to use, is there? Other than a couple of items, which they talked through about with the home births last week.
So I think so. We always have a delivery pack ready with any instruments we might need. But in actual fact, we find the vast majority of babies, all we need is 2 cord clamps and a pair of sterile scissors to cut the cord, and that's all we need. Gloves. And that is it. Towels. That's it. Nothing very complicated. So we're just camera's just going to follow me around this way. So we can see the whole of the birthing pool here. The door, music system, diffuser for essential oils. We've got all our cupboards at the top and at the bottom. Everything we need is in here, and we'll always have any drugs that we need for the delivery of the placenta in the room ready to go. Coming back across, past Julie. We've got a little ensuite facility in here. We've got a lovely shower and loo that's just for your personal use. You can have a lovely relaxing shower after your baby is born. Okay, and then we've got, obviously you can see the outside world. We can blind up or down. Bed, the resuscitation unit in case the baby needs any support after they're born. And that's basically it. What I forgot to bring into the room earlier is the gas and air. So many mums will choose to use Enterlocks or gas and air during their pregnancy. Julie's just going to go and get that for us. And the gas and air that we use here comes in bottles which are freestanding, so you come on a rather clunky trolley, and someone's going to bring one of those into the room shortly.
And sometimes if mums stay a little bit longer with us, we can take them across into one of our other rooms, which we can show them to our partners as well.
Yeah, absolutely.
Yeah, need any more support.
Okay. Do you want to talk a little bit about the postnatal care? We've talked a little about birth.
Yeah, definitely. So, being a maternity support worker, we're really there for you mums for after delivery. The idea is that we sort of can give you a little bit of TLC. It can be quite a scary thing going home with a newborn baby. So there's quite a few things that we would want to make sure that you know what to do with. So for starters, making sure that you're okay about putting nappies on. You know, you may never have had anything to do with any babies at all, and it's really important that we know that you're confident and happy with putting a nappy on. We also would make sure that you know how to hand express if you're planning on breastfeeding your baby, so that's something we'd make sure that you're aware of. And also if you're choosing to bottle feed your baby, you're quite happy about giving that baby a bottle when you get home. We would make sure that you've got lots of important telephone numbers if anything happens overnight. We have a lovely care plan which we send you home with. It's got a lot of information in there, and although you mums are going to be exhausted and really just want to spend that time with your precious bundles of joy, it's something that the dads can have a look through, see what's normal and what's normal. There's a really lovely sheet in there which tells you about the effective signs of feeding and about stool output and urine output.
Yeah. So remember that your blue notes, your pregnancy notes, will not go home with you. You'll go home with a new postnatal care plan, and we'll use this to record everything about your care, you and baby, in the days after your baby has been born.
So a few questions. Which essential oils do you have, or do we need to bring our own? Or what haven't we got?
Okay, we've got quite a range. So I definitely have things like lavender, peppermint, eucalyptus,
Clary sage,
rose, clary sage, lemon. Quite a range.
Rose.
If there's something you would like that you think we might not have, then feel free to bring it. We're happy to use it.
The music system. Does it just play the radio and CDs, or can we hook up to our phones to it? We're very fortunate at the moment because we've got beautiful systems.
Oh yes, we have got some little
we've got some little speakers which connect to Bluetooth. So if you want to download yourself a little music list of your favourite records, we know that Labour really goes well, doesn't it? If actually we've got nice music rather than drum and bass. Find records that suit your mood and make you nice and relaxed. So you can bring that in and we can connect it to our speakers for you.
Or equally, you might be using hypnobirthing, in which case if you bring your own tapes, then you can be listening to those as well in whatever format you've got them. So Julie's kindly brought the gas and air into the room, so it's basically a great big tank. You take it through a tube, so mum's completely in control of the gas and air. We usually use it with a mouthpiece that you just put into your mouth and breathe in and out. Some people prefer a mask, and we do have masks available. Obviously, Mum is not going to be wearing a COVID-type mask during the labour, but we do ask that Dad wears a mask while he's here. Gas and air is a very effective pain relief. We don't really understand how it works, but it seems to make people feel a little bit lightheaded and a little bit
One drink too many.
yeah. So they know what's happening, but they're not so bothered about it. It helps them to relax. Most people will find that if they use it for a few minutes, they'll get used to it and really enjoy using it. Again, like most things, occasionally people will say, I don't like it, in which case we can look at other options. I don't know if people want to know more about pain relief here, whether that's been covered in previous sessions, but please do let us know.
No questions as yet.
Okay.
We haven't really talked about what we're expecting before they go home, have we? Sort of if they're here and what we're looking at.
Okay. So you've had your baby. We've talked about the golden hour, which is a very precious time. It is lovely for you to be nice and calm, nice and quiet. Once that's over with and the midwife's happy with you, one of the maternity support workers then will be supporting the midwife and getting you all the help that you need. If you're not feeling like doing skin to skin, we get dads to do skin to skin if they want to, which is, I've never known a dad not want to do it and not enjoy it. It's really lovely. They see you might get you something to eat, drink, breastfeeding.
Best toast ever after delivery.
Sorry?
Best toast ever after delivery.
Toast and cup of tea, and I remember that mainly, the cup of tea afterwards. Yeah. And it's just a really, and we will encourage you to really enjoy that time. It's lovely. And afterwards, with the feeding help, if it's going well, we could discharge you straight out of this room when we've helped you with the shower and get your baby dressed and all that is needed. Or we might, if feeding's taken a little bit longer, get you to go over into one of our postnatal rooms. Postnatal rooms, you will be using them a lot afterwards. We see you officially on the first day home. We see you on day 5 and we see you on day 10 for discharge. But in between that, all you have to do is ring and we're here for you for anything you need. And please never be frightened to ask, because we love seeing you all.
No questions asked either. I think people will sit at home thinking you're bothering us, and that's what we're here for, isn't it?
Yeah. So your community team, wherever you have your baby, will visit you the day after you go home for where your baby's been born. And you can then talk to them about whatever support you need as an individual. Again, it's not about other people's births, it's about what you and your baby need.
Yes, we do have a microwave.
Yeah, we do. We have a microwave, we have a kettle, and we have a fridge.
And sometimes else would it would be useful to know about alternative pain relief, if you don't mind.
Okay. So we'll always emphasise what we call the non-medical pain relief to start with. So movement, massage, water, relaxation, essential oils, feeling safe and comfortable. Lots of people will use hypnobirthing and practice that. Massage, the TENS machines that we mentioned earlier. If we're going to find that they need a little bit more support, then we will normally, I'll wait for mums to ask for pain relief. It's very important that you ask for it. Women are very easy to persuade in labour because of the effects of oxytocin. So we're not going to be saying to you, do you think you want some pain relief? Because you will say yes. So we'll wait for you to ask, and believe me, you will ask if you want it. So we'd normally start with gas and air. If you find that that's not really doing it for you, and you're having quite a strong, active labour, we can offer you a form of opiate. We use a form called Meptin. In the hospital setting, we use diamorphine. It's an injection that's given into your leg, and this can give most women a little bit of relief from the discomfort for a couple of hours. Again, it varies a lot depending on how your body metabolizes the drug. So for some women, it will be quite strong and effective, and other people might feel it hasn't made a lot of difference, but it's quite hard to predict beforehand unless you've had it before. It can make people quite nauseous, so we normally offer you another injection that can reduce that feeling of nausea as well. If you did have that injection, we would get you out of the water because it makes you a bit drowsy, and you'd stay out of the water for at least 2 hours. We don't have other pain relief here in the freestanding unit. Very rarely, I'd say probably once or twice a year, women who are here request an epidural, and that would require moving to the job vacuum for that. I think most women who are here, they feel relaxed in the environment they're in the choice of their birthplace, and they find that they don't need a lot of pain relief. If you're in tune with your body and you feel well supported and relaxed, your body knows exactly what to do, and it shouldn't be painful. Discomfort is what we would say. It can be quite uncomfortable at times, but you should be getting plenty of gaps between the contractions, and we're here to support you and help you as well. The other thing I didn't mention, I know somebody will ask about, is stitches. So after the baby's been born and the placenta has been delivered, we can have a look at the perineal area, the area of the outside of the vagina, to see if you do need some stitches. It's quite common for women, especially having their first baby, for there to be some sort of tear. Most women will not even notice that it has occurred as the baby's being born, so don't worry about it, try not to worry about that too much. We'll make a quick assessment. You either clearly need to have some stitches, or you can get away with not having any. If we feel that stitches would be of benefit, we'll say so. We'll make you very comfortable here. We use lidocaine injections, the same sort that your dentist would use, to numb the area so that it's comfortable and not painful. And we aim to do that as quickly, get it out the way as soon as we can, and then we can give you additional pain relief to help with that recovery too. If by chance we find that the tear is very complex, or we're concerned that it is a more serious tear, again, that might be the reason why we would be transferred to John Radcliffe. The other thing we haven't mentioned is the vitamin K injection. Your midwife may have mentioned this to you during your antenatal period. All babies are offered a vitamin K injection soon after they're born to enable them to be sure that their blood is clotting correctly. We know that the vast majority of babies don't need this injection, but it is very hard for us to tell which babies are in need of it. So we offer it to all babies, but it's a personal parental choice as to whether your baby has this or not.
Okay. Can partners go through to the postnatal room as well? Yes.
Yes,
Yeah.
we can.
Yeah, yeah.
So,
And we'd encourage it too.
Yeah.
You're
We
doing
like to get
it
settled.
together, and mum might not hear something, and you
Yeah.
would, and you'll be supporting her at home.
Absolutely.
And I'm more likely to stay overnight if it's your first baby, or if all is well, will you be discharged within the 6-hour time frame?
Okay.
Women amaze us on a daily basis,
Mm.
don't they? At how strong and how wonderful and how awesome you are in delivery. And every woman's different, aren't they?
Yeah, absolutely. We're a freestanding unit, and we don't have an overnight ward as such. The length of time that people stay after the baby's been born varies a fair bit. They may only be here for 3 or 4 hours, or they may stay for about 6 to 8 hours. It depends what's happening. If you had your baby in the hospital setting or at the Spires unit, you would quite often be allowed to stay over the next night, depending on what time of day the baby's been born. So rest assured, we're not going to throw you out. As Judy said, we want to make sure that even if it's your first baby, your baby's had at least 2 feeds at the breast, if you're planning to breastfeed, and that you are confident about hand expressing colostrum to your baby before you go home.
And feel safe and got good
Yeah,
support network around you.
Yeah. And we also want to make sure that mum has made a good recovery, that her blood pressure and pulse and temperature are all normal, and that she's been able to empty her bladder normally after the baby's been born. So you're going home feeling well and feeling safe. Women who've had babies before will often be gone within a couple of hours, so it's very individual. It comes down to what your needs are, and to a certain extent what time of day baby's been born.
I'm not quite sure how long we've been running for. Do we want to go across to the postnatal room?
Yeah,
Yeah.
Okay, so we're just going across. Okay, so you can lead the way. So we're just coming out now into the corridor. We're quite a small unit here, and we're just in this top corridor. So to the right, you can't really see, is the entrance, and then we're going to go to the end of the corridor, some storage rooms, into the postnatal room that we most commonly use. You you're moving here after your baby's been born, and Julie will just give you a little rundown on the room.
So welcome to Norton Room, and this is, like Trish said, one of the most commonly used rooms when we're doing your checks after the birth. You might want to just come over here. They're all en suite as well. You'll see we've got a lovely, we did some fundraising, we've got a lovely comfortable chair here which folds right down, so we've got somewhere, if Dad just needed to shut his eyes for half an hour, there's a nice chair for him, and apparently it's really comfortable. It's also a lovely chair for breastfeeding. Mums, different positions for breastfeeding, everybody likes their own way of doing things.
We've got a lovely shower as well,
perfect.
in this room as well, haven't we?
Yeah, I just said we've got it's en suite. And then again, we'd shut the door once we're happy with you and let you just chill, and all that we've shown you. Just.
I really want to be at this delivery. The question is, if we bring cake, what type should we bring for you?
All sorts. Some of them like fruit, some Victoria sandwich, some lemon. Get busy.
We'll be very grateful for any cake you bring, but don't worry about us. We'll focus on you.
What cake you like?
Okay. Oh, what I had noticed actually is, if we could turn the camera, over here we've got the scale, because of course everyone wants to know how much your baby weighs. So that's another of the few things we will need to do before you go home. So we'll make sure the baby is weighed. This is important, not just because your family will say how much does the baby weigh, but because we want to be able to keep a track of baby's weight, especially when mums are breastfeeding, so that we can see the baby hasn't lost too much weight, and we can see weight gain later on as well. So getting an accurate weight is very important. And just to the right here, we've got one of our breast pump machines. This is not something that we would use for women. You probably can't quite see it. I'll lift it up. A little pump on a stand. We use this for women who come in perhaps in the next few days after giving birth and need some support with breastfeeding, and we can help them with the feeding if there's any problems there.
One more question, Trish.
Okay.
Thank you so much for all this information, ladies. Really
You're welcome.
helpful. I think you mentioned earlier, if we're from other areas of Oxfordshire, that we can still deliver at Cotswold.
Absolutely, yeah.
Is this correct? And do we need to do anything other than tell our community midwife?
Okay, if you are within the Oxfordshire Trust area and you have blue maternity notes, then contact us, and really ideally we would see you at around 36 weeks so that we can meet you here and have a quick look at the unit. If you're from another trust, and because we're here in the north of Oxfordshire, we're bordering Warwickshire, Gloucestershire, and quite close to Northampton, we do have mums coming from other areas. If you know that you would like to come here, or if a friend of yours thinks you might want to come here, please contact the unit. You can call us on 01608 697930. If you are from another area with different notes, then we would want to issue with new notes. We have to go through a whole booking again, but it is certainly possible. I'm always happy to chat to people who come in from different areas.
Should we have a look at the other bathroom, Trish?
Oh, okay, yeah.
Yeah.
We're gonna follow Sharon through, and we're gonna have a look at the second bathroom. As we're walking up the corridor, you can just see the entrance at the far end, the clinic rooms to the left. It's a bit dark, but this is where we do your assessment when you first come into the unit in labour. We use the bed there. And then right behind us, we've got the second bathroom. Sharon will just do a little tour for looking there.
Alright, yeah, you can see us. Okay, so this is our lovely beach room. You see, same thing again. We've got a pool in the room, we've got toilet and shower facilities in here, everything's in the room that we need. We've got a couple of extra bits in here, so we've also got the beanbag in here, and we've got, where is it? We did have a cub chair as well, didn't we, at one point? No. Okay, and we've got various mats and things as well that we can put down on the floor. Okay.
So,
Any more questions?
are there any more questions before we wrap up the session?
No.
Okay. Right, well, looking forward to seeing you all in the future.
Hope that's been helpful, ladies.
Right.
Yeah, bye-bye. Look forward to meeting you all.
Thanks for watching.
Thank you.
Trish.